It's a good day, PA. I'm Amy Kim. Do you have a problem with dry eye? New research shows as many as 86% of patients who experience dry eye symptoms are suffering from a condition called MGD. Dr. Andrew Leitzel of Mechanicsburg Eye Associates is here to explain what those abbreviated letters mean. And I told you I am not going to try to pronounce it, so you do it. What is it, sir?
That's a great question, Amy. You know, a lot of people who attribute their discomfort in their eyes to a catch-all diagnosis of dry eye. And they either become dependent on drops that only offer temporary relief, or they just learn to live with those problems. Now, we now know that 86% of people are actually suffering from a condition known as meibomian gland dysfunction, or MGD.
MGD, I'll stick with that.
Meibomian gland dysfunction occurs when the oil-producing glands of the eyelids become clogged or stop functioning. And the oil component, well, we actually know that the tears are comprised of 3 layers: an aqueous layer, water, mucin, and oil. And the oil component is so important because it keeps the eyes and the tears from evaporating.
Very good. So right here we're looking at normal glands, and then there's a flip side to this where we can see sort of what happens.
You can see in this slide that a lot of the glands have atrophied and gone away, and that's so important to catch this condition before that point, because once the glands are gone, they're gone forever. Oh,
yuck. Okay, so what are some of the symptoms to know that, hey, maybe this is it for us?
Sure. So commonly people will experience some scratchy, burny, or sandy feeling in the eye. But very commonly and less recognized, people will start to describe symptoms of patchy blurriness that occurs when they're reading or staring at a computer. It often improves with blinking. Other symptoms like intolerance to the contact lenses, they can't wear their contacts as long as they would like to. And also patches or spells of excessive watering in their eyes that may occur when you're in the wind.
So it's like you have the dry eye, but you also have the watering. What a mess. What a mess. So how do you treat it? What can we do?
This is probably the most exciting part. So at Mechanicsburg Eye Associates, we're offering a new approach to treatment. The procedure is called LipiFlow. And LipiFlow thermal pulsation technology applies controlled heat and gentle pressure to the eyelids. And what that effectively does is unclogs those oil-producing glands, restoring the body's natural ability to secrete the oil into the tear film. And this is so important because once the tear film stabilized, a lot of those symptoms will go away. We've been doing this procedure now for about a year. We've got a lot of happy patients, and people often notice relief within 3-4 weeks after treatment.
Is it a one-time treatment, or do you keep coming in and getting it again and again?
With proper management in place, our goal is to do one treatment and then maintain things to keep you in a happy place with your eyes.
Good. And how often do you have to do that then for maintenance?
Maintenance may include some nutritional supplements and or warm compresses, but it's pretty simple to maintain.
But not actually getting the LipiFlow again?
Correct.
Wow, that's phenomenal. This is so interesting. Where can we reach you? How can we learn more?
Give us a call. Check out the website, Mechanicsburg Eye Associates. Feel free to give us a call for an evaluation.
Very good. I think you're going to get a lot of calls about that. Thanks, Doctor. Good to have you on this Friday edition of Good Day PA.